Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the subject of anatomy under the topic shoulder girdle and upper limb and the subtopic humerus. So let's start the session.
Welcome to the examination. We will begin with the human anatomy, specifically focusing on the humerus. To start, can you explain the functional anatomy of the shoulder joint, particularly highlighting which movements are permitted?
The shoulder joint permits ball and socket.
Yes, it is a ball and socket variety. Since it is multi-axial, what specific movements does that allow?
It allows flexion, extension, abduction, adduction, internal, external rotation, and circumduction.
Excellent. Now consider a patient presenting with Erb's palsy, where the arm hangs by the side, adducted and medially rotated. What is the anatomical basis of this deformity?
Erb's palsy is caused by the damage to the brachial plexus nerves, especially C5 to C6 in the neck, usually resulting from stretching or tearing during a difficult childbirth.
That's correct. Due to damage to C5, C6, which key muscles are paralyzed, leading to that characteristic deformity?
The most common cause is shoulder dystocia, which causes paralysis of biceps brachii muscle.
The biceps brachii is one muscle affected, leading to loss of flexion and supination. Which other prominent muscles are typically involved at this point, like the deltoid, supraspinatus, and brachialis?
Other muscles are deltoid, supraspinatus, infraspinatus, teres minor, subscapularis is also included.
Yes, the paralysis of deltoid and supraspinatus causes the loss of abduction. Moving along, what are the contents and clinical importance of the cubital fossa?
I don't know, can you please explain?
The cubital fossa is the triangular depression in front of the elbow. Key contents include the termination of the brachial artery, the biceps tendon, and the median nerve. So it's important for feeling pulses and drawing blood. Now, can you describe the course and distribution of the median nerve in the upper limb?
The median nerve exits the cubital fossa by passing between the heads of the pronator teres muscle.
That's correct. What main muscles does it supply in the forearm, and what would be the consequence of an injury at the level of the elbow?
Median nerve supplies the back of the hand.
Actually, the median nerve primarily supplies the flexor muscles in the forearm and the thenar eminence in the hand, providing sensation to the ulnar aspect of the thumb, index, middle, and half of the ring finger. Injury at the elbow would affect forearm pronation and thumb opposition. To finish up, can you name the boundaries of the carpal tunnel?
Boundaries of carpal tunnel are under it passes the median nerve, but I don't know about the boundaries. Can you please explain?
Yes, the median nerve passes through the carpal tunnel. The boundaries are formed by the flexor retinaculum, which arches over the front, and the carpal bones at the back. This can be clinically important for conditions like carpal tunnel syndrome. We will conclude the examination here. Thank you. Please note, the information provided during this anatomy examination is not medical advice or diagnosis. For any health concerns, please see a healthcare professional.